Hi, I'm Jesse Boyd, and I'm the clinical team lead with Summit Stone Health Partners Co-Response Program out of the Loveland Police Department.
And I'm Maryann Flynn, and I'm a Summit Stone clinician with Larimer County Sheriff's Office.
The Co-Responder Program is a model of criminal justice diversion which pairs law enforcement and behavioral health specialists to intervene and respond to 911 calls that include a behavioral health component. Our teams use the combined expertise of the officer and the behavioral health specialist to de-escalate situations, provide brief therapeutic interventions, and help link individuals with behavioral health concerns to appropriate services.
While relatively new, the co-responder model exists nationwide and is helping change perceptions of mental health and destigmatizing care. The co-responder model prides itself in bridging the gap in communities by reducing stigma and broadening access to mental health services. The program and team structure varies between locations to best meet the needs of the community and partnering agencies, taking population density and other available resources into consideration. There are generally two approaches. The first approach is what we call the primary response model. This is an officer and a behavioral health specialist riding together in the same vehicle for an entire shift. And this is the approach we use at the Larimer County Sheriff's Office.
The Loveland Police Department follows a secondary response model, where the behavioral health specialist follows the officer or meets them at the scene, then tag teaming the call. If needed, this allows us to provide transportation without requiring the person to ride in the back of a police vehicle. On scene, the co-response team works to not only de-escalate the situation, but we also provide behavioral health screening, risk assessment, brief crisis interventions, and then help connect the client to helpful community resources and treatment options. We also provide more than just the initial crisis response. Afterwards, we have a case manager and peer specialist who can follow up with the individuals for support and additional resources. When community members have a crisis, they call 911 for help. Having a co-responder with law enforcement helps ensure that people are getting the right kind of support at the right time, with a trained mental health professional providing direct intervention, advocacy, consultation, and support during a behavioral health crisis. We love that we can support people on some of the toughest days of their lives. Let's hear from our partners at Loveland Police Department and Larimer County Sheriff's Office.
Hi, I'm Evey Sanger. I'm a police officer with the City of Loveland.
I'm Cheryl Jacobs with the Larimer County Sheriff's Office. I'm a uniformed deputy portion of our co-responder team.
I think Summit Stone co-responders are super helpful to law enforcement. It's awesome to have real-time on-scene response to help with mental health calls because that's when people need it the most.
I believe pairing a uniformed deputy with a licensed clinician is beneficial for everyone involved. The co-responder team allows law enforcement to return to law enforcement type calls that we are trained to do. It also provides safety and security for the clinician doing the evaluation.
Our co-responders can offer people the help needed in that moment. It's also super helpful to be able to speak with co-responders before going to a scene. They can give advice and in some high-risk situations help with giving backgrounds of some people, which in return helps us law enforcement know how to approach the situation.
It also benefits the citizens of Larimer County by providing them with the most appropriate resources for their situation. This, I believe, has a secondary benefit of helping prevent legal involvement of those experiencing a mental health crisis.
Summit Stone definitely makes my life easier and teaches me something new every time I go on a call with them. Law enforcement primarily focuses on the criminal side of situations, and we don't always see there's something possibly going on with someone, and Summit Stone can help us point it out.
If you'd like to learn more about the co-responder role, you can visit the Health Sector Partnership website or your local law enforcement website. We hope you've learned more about this important and unique role in behavioral health.